Welcome to the deep dive. Today, we're going to piece together a really complex and, frankly, pretty alarming picture.
Mhm.
It's about this mass exodus of UK doctors.
Yeah.
And it's not just a quiet few leaving. We're talking about a really significant talent drain from the National Health Service. The scale of it, I think, might surprise you.
It's quite something.
So our mission today is really to understand the core reasons, what's driving these medical professionals to actually leave the UK.
Right. And to help us kind of navigate this, we've drawn insights from, a pretty comprehensive deep dive analysis.
Yeah.
It pulled together official reports, surveys,
Okay.
data directly from key bodies like the General Medical Council, the GMC, and the British Medical Association, the BMA.
Yeah.
So these sources give a really clear sort of ground level view of what's happening.
And just to give you a sense of the scale right off the bat, reports are indicating a staggering figure. Something like 70,000 doctors are reportedly feeling, quote, sick of working in the UK.
70,000. Wow.
That number alone, it's a potent indicator, isn't it, of just how widespread this feeling is.
Absolutely. A huge number.
Okay, so let's unpack that then. Let's get into the hard data.
Right.
What do the actual departure numbers tell us? Because the trend seems to be accelerating and rapidly.
It really is. So if you look at 2023, the report cited say 4,000 doctors left the UK to work abroad.
4,000.
But then just a year later, 2024, that number didn't just climb, it skyrocketed. Nearly 21,000 doctors.
21,000 from 4.
Yeah, a massive jump. And the projections looked at for 2025 suggest these numbers could potentially double again.
Double again.
Right.
It makes you wonder about the practical impact, right, for patients just trying to get seen.
Precisely. And the underlying reports, they offer direct insight into that. And it's quite grim, frankly.
So why? What are they saying?
Well, when doctors are asked why they're leaving, the overwhelming reasons seem to point to two main things. Pay, which they feel is inadequate, and what they describe as, and this is their word, atrocious working conditions.
Atrocious. That's strong.
It is. And another really significant frustration that comes through is the difficulty in actually securing training posts. Even after investing years, huge costs into their medical education.
So they finish studying, they're ready to go, but can't find a place.
They struggle to find viable pathways within the system to continue their specialist training. It's a real bottleneck.
And if we dive into the pay disparity specifically, that really highlights a core economic driver here, doesn't it?
Absolutely.
We take a foundational training salary for a UK junior doctor. It's between £39,000 and £44,000?
Roughly, yeah. Which translates to maybe 52,000 to 60,000 US dollars.
Okay, now compare that. Compare that to what a physician might earn starting out in the U.S. Reports suggest anywhere from, say, $60,000, maybe $75,000 just to start.
Right, that's the starting point.
Exactly, and that's just entry level. For specialists in the U.S., earnings can, soar up to $500,000 sometimes.
Yeah, the figures mentioned are primary care physicians, around $287,000, specialists, maybe $440,000 on average.
These U.S. figures are significantly, sometimes considerably higher. It's a huge difference.
It really is. And what's particularly revealing here, it's not just the push factors, the reasons to leave the UK, but there's also a very active pull factor. The analysis we looked at points to recruitment agencies abroad. They're quite literally headhunting UK doctors.
Actively recruiting them?
Yeah, indicating a very organized sort of international effort to attract this talent. They clearly recognize the value these doctors bring. So it's not just doctors deciding to leave, they're being actively pulled away too.
Which must be frustrating from the UK government's perspective. The source mentioned they feel, that other countries are effectively stealing doctors.
That's the language reported,
Yeah.
Stealing doctors that the UK has invested in, trained, and, essentially paid for. And this brings us to a really crucial point about that investment. The data indicates it can cost up to £250,000 of taxpayer money to fully train a doctor.
£250,000.
Yeah. Now, okay, medical students do pay tuition around £9,250 a year, capped at about $50K over the 5-6 years.
Right, but that's often loans, isn't it?
Exactly. Often government-backed student loans, not always fully repaid. And crucially, the NHS itself directly funds the clinical placements and all the postgraduate training stages. That comes entirely from taxpayer money.
Okay.
What's noted in the reports, though, is that sometimes certain government perspectives can portray doctors almost as a burden in this cost context.
A burden, even though they're working.
Right, even when they're actively providing patient care, doing doctor work, and learning on the job simultaneously. It's an interesting observation from the source material.
So, okay, they're trained potentially at significant public expense and they decide to leave. Where are they actually going?
The reports show a clear pattern. The top destination, by quite a margin apparently, is Australia,
Australia.
followed very closely by New Zealand. Then you have Canada in third, the USA is fourth, and Ireland comes in fifth.
So mainly English-speaking countries with similar systems, perhaps?
It seems that way, yeah. Seeking, more appealing professional environments or better opportunities elsewhere.
And if we kind of connect this to the bigger picture, you mentioned this isn't just an England problem, right?
No, absolutely not. It's vital to see this isn't isolated. The reports highlight some really alarming situations right across the UK.
Like where?
Well, in Scotland, for instance, there was mention of a, quote, damning report. It warned that patient safety is compromised in nearly half, 46% of cases, at least once a week in their emergency department.
Once a week? Due to what?
Directly attributed to severe backlogs, overcrowded wards, and this thing called corridor care.
Corridor care? You mean treating patients in hallways?
Essentially, yes. Treating people in hallways, temporary spaces, because there's just a critical lack of beds or staff. And Dr. Ian Kennedy, who chairs the BMA in Scotland, he described their health service as having a workforce on the brink of collapse, operating with, quote, dangerously low doctor numbers.
And the doctors themselves feel it.
The stats seem to back that up. Only 37% of Scottish doctors reportedly feel supported, 40% feel unmotivated, and a significant chunk, 22%, are actively looking to immigrate.
That's Scotland? What about other parts?
Well, the analysis pointed to Northern Ireland as, in some ways, ranking the worst.
Worse than Scotland? How so?
Well, the figures cited were 26% of their doctors at high risk of burnout. Over half, 54%, struggling and actively considering immigration.
Over half?
Yeah. 48% dissatisfied with their work. And get this, 73% working beyond their rostered hours regularly.
73%. I mean, that just paints a picture of an utterly overburdened, profoundly burnt-out workforce across the whole UK, doesn't it?
It really does. So, given these, widespread issues, the overarching perspective presented in the source material we looked at is that the UK's healthcare system, which, let's be fair, functioned effectively for a long time, has, quote, gone downhill big time in recent years.
Gone downhill big time. Okay. Any reasons given for that decline?
Well, the source attributes this deterioration, at least in part, to specific government economic policies. The report suggests that approaches described within the source as socialist ideas have perhaps exacerbated the problem.
Okay, how so?
The argument presented in the source, and it's important we state this, their viewpoint, is that capitalism, specifically without monopolies or lobbying, would work best. They seem to contend that centralized planning has stifled innovation and responsiveness.
Right, so the source argues market-driven systems might allocate resources more efficiently.
That seems to be the argument presented, yes.
Right.
Again, we're just reporting the perspectives we found in the material, not endorsing any particular economic view here.
Understood. So bringing it back to the listener, what does all this actually mean for you, when you need to see a doctor or get treatment in the UK?
Yeah, the practical impact.
The reports highlight what are being called forever waiting times.
Forever waits.
Yeah, including apparently anecdotal accounts of waits stretching to 2, 3, maybe even 4 years for certain appointments.
4 years.
Yeah.
That's quite something. It paints a pretty stark picture, doesn't it, for healthcare accessibility for the average person?
It really does. So faced with that reality, what does the source suggest people can actually do?
Well, it basically outlines 2 individual choices for navigating this situation. Either, complain, write letters, advocate for change, or option 2, if it's financially feasible for you, is to go private.
Bypass the NHS waiting lists entirely.
Exactly. And the speaker, whose insights were compiled in the source material, actually shares their personal solution. They opted for private health care, which they state they could do because they'd built multiple streams of income.
Right, so a private solution for those who can afford it.
That's the perspective offered, yes.
Okay. This deep dive, it really does lay bare some critical challenges, doesn't it? Facing the NHS, the systemic pressures driving this exodus, it's not just numbers. It feels like it touches on the very foundation of public health care.
It really does. And, considering this escalating rate of doctors leaving, the conditions described across the UK, It leaves you with a pretty significant thought to ponder, doesn't it?
Which is.
Well, thinking long term, what are the implications for the accessibility, the quality of public health care? Not just in the UK, maybe, but in other nations with similar models. And, how might individuals, how might policymakers even need to adapt to what seems like a dramatically shifting landscape in the years ahead?
A big question with no easy answers.
Definitely something to think about.